So setup is going to be the big thing. I like using the treatment rooms because of the bed. They go up higher. If you have a patient that doesn't feel safe, you can always put the side rail up. But you want to position the patient as close to the edge as possible so that their shoulder is right on the edge. And I like to put down a draw sheet underneath the patient in case they do pass out. We can help position the patient. Before we put the finger traps on, I cut the stockinette to where when I'm measuring, I have it right at my wrist and then the thumb. So the stockinette won't actually cover the wrist area to where the doctor's pushing. You need to put this on before you put the finger traps on. Otherwise you won't get, once you put the finger traps on, then it's all set. Sizing for the finger traps, we have the whites are large. We have red and black, which are medium. We also have red and black that are extra large. And then we have kind of the small, extra small. So they're all in the carabiner, so you can kind of just grab the size. And the biggest thing is I hold the knuckle, and once I push it on past, I give it a kind of a little tug to make sure it's going to stay. Between the same size, you might have to try different ones that get stretched out over time. So a good example of it not staying, do that. So, same one, two different brands. So then we have where we're going to hook up. On the second one in, I have a Sharpie marked, and that's where the clips will go. We'll show that once we get hooked up. Make sure all the connections are facing the same way, and that you don't connect them crisscrossed. And once you get them hooked up, then we can raise this up. The bed positioning is at its highest, so it's easier on your back. And just make sure that that's nice and snug so it's not going to slide down once we get the weight on. Before we start putting weight on, I'm going to clip. And where I try to get is right below one of the little balls, but to also clip it right in the little notch of the clip. So sometimes if you need to, you can pull it down or push up a little bit to make sure it gets into the right spot. What that's going to do is that if I take the thumb out, it's not going to slide. So if we didn't have that, and I took the thumb out, that patient's going to drop. And if the patient had weight on, that's going to be very uncomfortable. So this is kind of a safety measure to keep, so that if any of the, if the pinky or the thumb come off, it doesn't keep it from sliding. So then we're going to place the bicep strap. I know that I'm going to place the splint roughly 2 inches above the elbow. So I just want to place the bicep strap right above that. I start with 4 pounds. So each of these small ones are 1 pound each. Connect it and don't just drop it, but slowly just kind of add it to the patient. Just like that. So now we are going to slowly add weight over a span of about 5 minutes. During this time, I will sit there and measure for a reverse sugar tongue. So we're right at 20. So right up here we're at 20. So I'm going to take that and mark it on the box. Alright, 20, and then I'm going to double that to 40. So 40 is going to be my overall length. 20 is going to be where I cut my V to go in between the thumb and the index finger. At this point, I will add weight. When we're adding weight, again, I try to stabilize and then slowly bring it down. So about every 30 seconds or so, I'm going to add weight. Depending on how the patient is tolerating, try to get up to 14 to 16 pounds. There's 16 pounds on this, because all the other weights now are 2 pounds each. So as I'm slowly adding weight, I'm going to finish getting the patient ready for that. That's fine. So for padding wise, I'm not going to pad anything from the wrist to about there, so that when the doctor comes in to push, they're pushing right on skin. The other thing is they usually have a Band-Aid on for the block. I take the Band-Aid off. I don't like to put anything with adhesive underneath splints because they heat up and can really stick to the patient's skin. So if we have an older patient with thinner skin, that can then cause a skin tear when we go to take that off. So if we have wounds that need to be covered, you can put dressings on the wound and then just use gauze wrap and then tape onto the gauze wrap. Don't actually tape to the skin. So I pad the elbow to make it more comfortable for the patient. And with this I use 2-inch padding, because then once the doctor is about to come in, I'll pad up here as well to make it a little comfortable for the patient. And I just like the thinner material, the 2-inch. So we would keep adding weight at this time as well until we get up to that 14 to 16 pounds. If someone is smaller, under 100 pounds, then we look at 8 to 10 pounds. So at this point, we have at full weight, we'll wait 10 minutes. At this point, I usually go get the doctor after 5 minutes of being at full weight to make sure they have time to come in. I'll also pull up the images on the computer so that the doctor can see where they need to push to help with that reduction. So at this point, I'm going to take the thumb out. And I know it's not going to slide because of my clips. I place the finger trap just out of the way, and I'm just going to make a little notch or a little hole for the thumb, like that. So when the doctor is in the room, that's when I cut the material. I don't cut it before, so we have plenty of time to get it to set properly. We don't want the material to harden too fast. write the numbers on the box so I remember what my cut is. I'm going to cut 40. And then before I cut or trim the edges, I look to see if there's any side that has a lot of resin that's seeping through. So this side doesn't have any resin seeping through, so I'm going to place that down because that's the side that will go towards the skin. This one has a couple spots where the resin is seeping through, so I don't want that going towards the skin. Open it up, trim your ends, and kind of give them a little rounding so nothing's going to poke the patient. And then I know my second measurement is 20. And what I'm going to do is I'm going to cut to the point where I just have about a 1/4 inch, maybe a little less. So 2 to 3 strands of material, and then I cut a wedge out of that. And that wedge is going to help kind of sit like so, and then sit like so that we still have full range of motion with the fingers. And then when I spray so that I don't get the tails, so I have more time to wrap the tail. So, because the doctor's going to sit there and be pushing and holding that, so I want this area to harden faster, and that will be right here. But then I can take my time to wrap the tails, because then it's going to harden at a little slower rate. A little squirt. And I cut my V just in the fiberglass, and then I find it where the point is, and I just cut one straight line all the way up to that fiberglass. And I like to do that so that I have nice padding for the patient. Come around here, we're going to pad just the wrist. Just so that it's a little more comfortable for the patient sitting in that splint. Movement with that thumb. And then with the splint material sitting on the counter, if you pick it up right at the hinge, my wet side is going to be out, my dry side will be towards the patient. And with that moved, it's a lot easier to come in with my splint material. As the doctor is holding, you're just kind of making sure that this doesn't get pushed up. A lot of times this gets moved up when they're trying to hold that bone and push up on that bone. So, and then we'll just bring the stockinette down. And again, with that V, this becomes a really nice padded spot for the patient, so when they make a fist, they're just hitting that padding. And I like to leave a little longer of the stockinette that's going up, so that when we bring this down, I don't have to worry about going between the thumb and the fingers. The stockinette's going to hold that splint material in place. And then we just start wrapping. So right at the front here, you have to be a little careful, because what's going to want to happen is that you create like a little dome where it's not going to be right on the skin. So right about below the thumb. And you don't want to go too tight with the A-strap, but snug to hold everything in place. And at this point, you'll be working around the doctor's hands and constantly kind of having to readjust the splint material. So I kind of leave the tails, and I'll use that for my second ace wrap. So up here is already starting to harden, where this is still nice and pliable. So I got plenty of time to wrap that. You don't have to be rushed during this process. And if you do kind of the outside or the top portion of the hand first and then the bottom side, what happens is that then your little edge is away from the skin. Fold that in. So during this point, the doctor might have you take over holding until it's fully hardened. They also might have you take the weight off as well. A lot of them do like to stay in traction and still hold until that splint material is hardened. Depending on how displaced it is, they also might take them out of traction and off the finger traps to put over their knee to put a little more bend in it as well. All varies on the doctor. Once this is fully hardened, you can then take them out of the finger traps. To do that, grab the bottom and pull up, and make sure you're holding on to the patient's elbow so they don't drop. And then you can have them just rest their arm right on their chest. The other reason I like to use this screw is that then we can lower the patient down, and a lot of times they've already got narcotics. We've also just pushed on bones so they can feel lightheaded. So sitting up too fast and standing could cause them to get dizzy and fall. So on here we have the chair option, and you can just hit the chair option and it'll drop the feet and bring the head up and turn it into a chair. And I let them sit here for about 5 minutes to allow their blood pressure to return to normal. So.
Thank you.
And cut.